This is the third video in a set of 3. The first video was how to identify a choking infant. The second video was how to help a choking infant. And this third video is about how to perform infant CPR in case it becomes necessary. We're going to take a look at what happens if baby goes limp. So if while you're working on them, all of a sudden you realize that their poor little arms and legs have just started to dangle. So if instead of moving around like my little guy is right now, if the arms and legs were simply hanging down, that's a CPR scenario. And to learn how to help them out, I'm going to sub my healthy and well guy out for a mannequin. So give me 2 seconds, I'll be right back. So now I have in front of me a mannequin representing our unconscious, non-responsive infant. If we've reached this stage, the first thing I want you to do, if there are other people there with you, is to send somebody to go call 911. Get them to make that phone call, tell them to come back and tell you what the dispatcher said, and while they're going and doing that, you're going to perform CPR. If you're the only person on the scene, you're going to start performing CPR, do it for approximately 2 minutes, that's about 4 or 5 rounds, and if they haven't revived, then you're going to go call 911. And please remember, babies are kind of like footballs, which means that if you have to, you pick them up and you run with them. You can do that. Babies, because they're also portable, it means that you can perform CPR on any hard, flat surface. The floor, a bench, the coffee table, the dining room table, or kitchen counter. All fair game. The only things I don't want you to do are perform CPR in your lap. Reason for it, your legs dip in the middle, which means that as you're pressing on them, they can actually fold into that space. They're not actually compressing, they're just bending. And don't do it on something like a couch cushion or a mattress because again, the surface is giving way, so the compressions are not being as effective. As I start CPR, I'm going to keep in mind that CPR is actually really easy. It's the same for any body size. You just got to remember that big bodies need big CPR and little bodies need little CPR. Well, this is a little body, so the first thing I'm going to start off with are 30 chest compressions appropriate for this size body. You need to get at least 2 inches into the chest to perform effective CPR, and on an infant, it looks really awful. It looks like 1/3 to half the depth of their chest. Nobody likes the look of it, but that's how deep you need to go if you are going to compress their little heart and effectively pump that blood through their body. So, same place that I pressed when I was practicing my conscious infant choking, so that center line, the armpit line to the center of the chest, it's the same landmark for CPR. Kind of nice, so here I go. I find my landmark and then using 2 fingers, 3 fingers, my knuckles, my wrist, my fist, whatever's most comfortable. The important thing is concentrate the force in the center of the chest, get that 2 inches or 1/3 to half the depth of the chest so we can do an effective pump and then do it 30 times. Here I go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 25, 26, 27, 28, 29, 30. That sound that you hear coming out of the mannequin, your child is probably not going to make that noise. That's just because there's a fake practice lung inside. It's got some styrofoam or it puffs up a little bit. You might hear a little escape of air, you might not, but don't focus on that sound. That's just because of the mannequin. So I performed my 30 chest compressions. The next thing I'm going to do is I'm going to put some more oxygen into the system. I'm going to try giving 2 breaths. Now, little bodies need little head tilts. It's almost like walking into a room and going, what is that? Something smells bad. We call that the sniffing position. You're going to tilt baby's head into the sniffing position. They don't need their head cranked all the way backwards and apparently lifting the rest of their body off the ground. Little tilts. Sniffing position, and they also have little airways, so their mouth and nose, that area is so small, my mouth fits over top of both. So with an adult, whereas you might pinch the nose and stick your mouth over just their mouth, because otherwise you'd be eating their face is so small, my mouth is big enough, I'm going to seal them both at the same time. Looks a little something like this. And with my mouth over top of their mouth and nose, these are little lungs, so they need a little bit of air. I'm just going to do a puff, about the same amount of air as it takes to fill my cheeks. And so, depending on the size of your screen, you may or may not be able to see this, but watch the chest, because I'll know that I've put in the right amount of air for this size body when I see the chest go up. As soon as it goes up, I'm done, I stop, but I'm going to look for the rise in the chest. Here I go. There it was. And that's 2 breaths for this size body. And that's CPR. 30 chest compressions, 2 breaths. 30 chest compressions, 2 breaths. And you just keep doing it over and over and over. You find your groove and you keep running with it. Now, taking a look at what we have here, 30 to 2, I'm effectively trying to imitate a healthy heart rhythm and healthy breathing. So taking a look at rates, how fast we're doing things, if I go super fast, because I'm kind of freaking out right now, that's like a jackhammer. That's not how the heart normally pumps. You want healthy, normal heart rate, and a great way to find that is to just sing a song that nobody sings too fast or too slow. For example, row, row, row your boat gently down the stream. That'll do the job, and once you found your groove, keep going. If because you used a song to find your groove, you lose count, you end up doing 24 compressions or 37, in the end, the numbers don't matter. I want you to thump and blow. Pump that circulation, spread that blood through the body, add more oxygen, and then keep pumping it around. That's what CPR boils down to, okay? So, last things to keep in mind. As you're working on an infant, if they were choking, that's how you ended up here in the first place. Your first 30 chest compressions may actually have popped up the object that was blocking the airway. So you can take a look and see if there's anything in the mouth that you can scoop out. If when you try to give your breaths, they won't go in, there's resistance, the chest won't rise, don't blow harder. That's not what you're going to do. Instead, you're just going to go, the first breath didn't go in. You know what? That's probably my fault. I probably just didn't tilt the head back far enough. You're going to tilt their chin down, tuck their head back a little bit farther, try your second breath. If the second breath doesn't go in, no panicking. You're just going to think to yourself, okay, choking scenario, that's not my fault, that's the choking object's fault. Okay, I'm going to go back to the beginning and try again. And you just go back to pumping the chest. So the rhythm doesn't really change. It's still 30 to 2, 30 to 2. And just if you realize that your breaths aren't going in, don't panic. Just try the first one, didn't work, re-tilt the head, try again, didn't work, go back to your 30 compressions. If you've been looking in the mouth and you find something and pop it away, great, you've got an open airway. Sometimes though the object doesn't become visible, it just shifts enough that we're able to get air past. If you find it changed and you're now watching the chest rise and fall, that is awesome. And you're just going to keep doing 30 to 2, 30 to 2 until those paramedics show up. Or if somebody happens to bring you an AED, maybe you found yourself in this situation when you were at an arena or at a mall, then you're able to make use of an AED as well as part of a CPR scenario. I've got one more bonus video for you, and that's a practice video. There's 5 rounds of CPR that you can practice so that you can train muscle memory. Muscle memory means that even if your brain goes blank because the adrenaline's going and you're kind of freaking out, your muscles still remember what to do. So feel free, grab yourself a doll or a couch cushion, anything that you can squish really, and click this link right here. It's going to take you to that practice video. I'll see you there.